I'm Peter Block here in TCT, and with me is Deepak Bhatt, and this is our final wrap-up for the late-breaking clinical trials from this meeting. We want to talk about three for this final wrap-ups: a trial of renal denervation, yet another one, but sort of an interesting one, the PRIMA trial, and Excite-RSAR. So let's begin with the renal denervation trial. Deepak, yet again another trial, this in patients who are not severely hypertensive but resistant, 3 drugs, and the outcome to you is what? What do you think?
Well, it's a bit of a mixed picture. It was a small study, well done, but a little over 30 patients in each arm, and sham controlled, and the primary endpoint wasn't met, but in a per protocol analysis, it looked like there might have been a reduction in 24-hour systolic blood pressure. So a bit of a mixed signal. I wouldn't clearly call it a positive trial. It certainly doesn't support the use of renal denervation outside of clinical trials, but on the other hand, it probably means we should keep investigating, so the field is still alive.
I think so too. It seems to me that with a larger trial, they may have shown a real difference here. And remember, these are patients not severely hypertensive.
Right.
Systolic pressures in the 135 to 145
Absolutely.
range. So we'll see. I think they'll go bigger and have more patients, and we'll see what happens.
Yeah, reason for hope, but a call for more study.
There you go. Let me talk about PRIMA. That's one of my favorite things, this PFO closure business. This is patients that had migraine with aura. Can you reduce migraine with aura or migraine by closing a PFO? And this is a fascinating study for me anyway. The primary endpoint was not met, as you know, Deepak. But the interesting thing is the primary endpoint was total migraine days. But the interesting thing was aura was significantly reduced in these patients. And for a patient with severe migraine with aura that simply can't do anything, I think the signals here are that even though this is not a positive trial, it tells us that maybe we ought to look yet again. And I know that's boring because it's been a long time since we tried to figure this out.
Right.
But this doesn't kill it, do you think?
Yeah, I don't think it kills it, but I've got to acknowledge that the primary endpoint wasn't met here. It wasn't sham controlled, so patients with migraines, they're many times in extremis, so placebo effects could be possible. So I think, again, it doesn't kill the idea of PFO closure for migraine, but I would say more study is needed. Larger studies are needed before this is ready for prime time.
Absolutely, no question about that. So the last one is Excite-RSAR. This
I'm excited about it.
Yeah, this is a good trial. We're excited about Excite. This is plain old balloon angioplasty in the femoral arteries versus laser atherectomy. We're going to dust off the laser again? I guess so.
Yeah. No, I was actually surprised because I was thinking about the laser experience for coronaries and restenosis, and it wasn't really particularly positive, but I was surprised that this trial for SFA lesions, it actually looked really good, better than PTA alone, adding laser to PTA. So, in a randomized trial in peripheral intervention, got to give them credit for that. We need more of that.
There's no question about it. This is one of the few randomized trials for peripheral data, and high grades for doing that. We need a lot more of this kind of thing, but this is a clear win for laser atherectomy.
It is. It really is.
Yeah. So, 3 important trials, lots of information, some good, some bad, some equivocal, but that's what happened at TCT.